I'd like to welcome you all here this evening. My name is Elizabeth McClellan, and I'm the founder and president of Partners for World Health. And our program, the Global Health Education Forum, we ordinarily were doing this in the past once a quarter, but since COVID started, we decided this summer that we would do it every month to try to pull in as many people, students and other interested parties. So we kicked it off in September. And we're doing with Bangladesh. I talked a little bit about Bangladesh and the sex trafficking industry over there. And then we have Laura that Zoe will introduce you to. And then in November, we have Ann Carroll, who's a registered nurse and also works for us in the medical supply program, who will be speaking about her medical mission work in Uganda, especially in NICU at the Malago Hospital, where we do a lot of work over there every January on our medical mission program. And so we will do this now from September, October, November, and then we'll start again in January and do January, February, March, and April. And it's open to anyone. We're trying to advertise on our email blast as well as on Facebook. So if you know of other people that are interested in participating, they just need to watch Facebook, or they can send us their email address and we'll be happy to add them to our list. We have 3 door prizes this evening, and we will, Zoe will share those with you at the end. You must still be on to win. So we're putting all of your names in the hat, and then we'll pull your name at the end of the evening, and you can pick up your item at the down here at Zoe's office. And Zoe is our newest hire to Partners for World Health, Zoe Lewis, who's now our new volunteer coordinator, and we're pretty excited to have her on. She's been here for a little over a month, and she's going to introduce Laura, who is also a new hire. She started in March as our operations coordinator. So we want to welcome all of you here. A few more tidbits is that sadly our medical mission program has been canceled for the whole year of 2020 because of coronavirus. We are hoping to continue our program in 2021. However, I do not think that we will be able to do Uganda in January or Bangladesh in March because I'm not sure the vaccine will be available to everyone by then. So we're hoping that our program will begin again in May at our Senegal medical mission. You know, one of our mandates going forward is that everyone who participates in a medical mission now with Partners for World Health will have to have a coronavirus vaccination. It's just similar to the yellow fever vaccination that's mandated to go into Africa. So it's just one of those things we have to learn to live with. Other than that, we're really glad that you're here, and we welcome any of you to come down and volunteer, or if you haven't participated in our volunteer orientation, and then come on down. So thank you very much for joining us. And now I'm going to introduce you to Zoe.
Hi, everyone. Hi, everyone. As Elizabeth said, my name is Zoe Lewis, and I'm the new volunteer coordinator. Just a couple of logistical things tonight. As Elizabeth mentioned, we will be doing a drawing for 3 door prizes, and we will be doing at the end. So you have to stay till the end, and I'll be calling names and drawing it out of a hat. And please just speak up to say that you're here, and so we can mark it. If we don't hear anything, we'll move on to the next name. Also, we'll have about 15 minutes at the end for questions. And so if you think of questions throughout the presentation, feel free to type them in the chat, and then we'll have time at the end to hopefully answer everyone's question. Let me enter this person, and that's everything. So now I'll hand things off to Laura to get started.
Okay. Thanks, Elizabeth. Thanks, Zoe. Hi, everyone. My name is Laura. I am going to get situated in the screen for a second. So I'll present first and then switch. Yeah. Okay.
So let me share a little bit of information about Laura. Laura is our new coordinator for operations coordinator. And as I mentioned, she started in March, and she's the one that you will really be working with when you come in as a volunteer. She also supervises all the interns that we have, and we actually have 4 interns this fall, and we'll have more in the spring and again in the summer. Laura joins us from an organization called the Center for CE.
I was thinking of Project Bead.
Yeah. Center for the What is it?
It's CIEE, which stands for Council on International Educational Exchange.
That's right. And she holds a master's degree in global studies. And she was instrumental as one of the co-founders about starting the Bead project when she was in school. And that's what she's here to talk to us about today, is the Bead project that was started in Ghana. So we welcome Laura, and we're really glad that you're here working with us at Partners for World Health.
Thank you. Thank you. Yeah. Let me see if everyone is good. Good to go?
Yeah, you guys probably not sharing.
Oh, I'm not sharing? Oh. Okay. Okay, so hopefully you can see my screen, and I'll get started. So thank you for the introduction. If we were in person, I would ask everyone to just say hello and let us know where you're from, but we're gonna probably skip that step. A lot of black boxes on the screen here, but thank you for joining me today. A little about me, my name is Laura Garlo, as Elizabeth has mentioned. I am co-founder and director of Project Bead, as well as the operations coordinator here at Partners for World Health now. A little bit about me, I grew up in pretty rural Western Massachusetts, small town. I would say that I was not exposed to a lot of other cultures in these communities. Pretty much everyone looked like me, had very similar background, Western European descent, Eastern European descent. So I was challenged at that point to really find myself in this global environment. So when I met someone from a different culture, when I learned about them, when I could watch a movie or read a book, I really latched on. And looking back at my experience, I found, Spanish to be my favorite subject in school. I was really interested in a friend who moved from a different country, and I really latched on to her as kind of like, ooh, what are you eating? Where are you from? What is your mom speaking to you right now? Everything like that. So I, tried to expose myself in different ways, and that carried me through college and then onto my career here as well. I went on to business school at Bentley University right outside Boston. So I double majored in accounting and finance as well as global studies. I had a Spanish minor, still keeping that Spanish going. And I also worked a lot on Project Bead. So as you can tell, this took a lot of my time in school. And it was really an outlet for me to be working on this project. After school, I was kind of funneled into auditing, of all things, as an accountant. And if you know me, you can probably understand why I am no longer in that position. Didn't last very long, but I learned a lot. But truly, I was kept sane in that role because of Project Bead. So I would be working after the long hours, before, sometimes during, and on the weekends, we would be doing events. I would be traveling to Ghana once a year at least. So that really just kept me going. So it's been the constant since 2011. Now I've been in Portland for 5 years. I have been working in international higher ed, as Elizabeth said, while I pursued my master's in global studies at Northeastern University. I am fascinated by how cultures interact, how they clash, how they develop, adjust, how they thrive, sometimes how they suffer. And I just have found myself always wanting to know the world. I want to know the people, I want to know the places, I just want to know everything about it, because I really feel like what else is there other than understanding humanity? And really at the existence of humanity, I find to be good health and good education. And the link between those two brings me to my presentation today, as well as my career path here at Partners. So let's get started. Maybe. If I could click the screen. Okay, here we go. So thank you for joining me. No introductions because we're on the screen, but I appreciate everyone being here. So Ghana at a glance. Maybe some of you have heard of Ghana, maybe you know where it is. For those of you who are unfamiliar, Ghana is located on the equator, on the west coast of Africa, the southern coast of West Africa. It is a very lush place right on the equator. It has a heavy rain season and a heavy dry season. It is very hot. My first experience, I can just remember comparing to when you open up the oven when you're roasting something at about 400 degrees, and that's how it feels all the time. So that was in the dry season. The wet season is very different. You constantly feel like you're sweating, even if you're maybe not. So it's a very equatorial location. There are about 30.4 million people in Ghana after the last census. They're highly concentrated though in Accra, which is the capital. That's on the southern coast, right on the ocean. Kumasi, which is in the center of Ghana, almost dead center, and that's really the cultural capital of Ghana. So if you speak to someone from Ghana or visit yourself, you'll hear that, oh, you have to go to Kumasi. It's really where Ghanaian culture is found. And then if you go north to the very northern region, there's Tamale, which is another large city there. And that's actually, I read last night, one of the fastest growing cities in West Africa. So there's a lot of commerce developing there. It's extremely dry. It's more of getting closer to the Sahara Desert. So it's a different environment and really a different culture as well. Typically the country is split between Christian in the south and Muslim in the north, kind of going along with the countries in the region there. Ghana is uniquely split between the two. There were very strong, what we would call Ghanaian empires of the Akan people in Ghana prior to the British colonization. So when the British got there, they noticed that a lot of the structures were already in place, very similar to their own. They did overtake the empires there that existed before them, but they already had a lot going for the people. So it was kind of one of the easier colonies that I learned about when I was studying West Africa. So there was a lot of profitable exports. Ghana is extremely lush, like I mentioned. So palm oil, palm products. There's a lot of gold in Ghana, actually, a ton of gold. They called it the Gold Coast for a very long time. And there is just a lot of value in the resources, the natural resources in Ghana. So the British had a really good time with them as a colony. There was a lot of peace between the British and the local Ghanaian people. I mean, that's from my Western perspective, but if you look, there were not a lot of wars compared to other locations. So the British had a really successful stint, I guess, with the Ghanaian colony there. You might know Ghana though because of its complicated history with European colonizers and the West African slave trade. Ghana was one of the largest ports of exit from the continent, where many of our African American people will find their descendants to have come from. So you may know it because of the slave castles located there. There's a really large one called Elmina Castle. It's located in Cape Coast, which is about 3 hours west of Accra. And estimates are around 30,000 Ghanaian and West African people left that port to go on to first Brazil and then up to the Americas. Highly recommend the tour if you're ever in the location. And I do have some tour guides to recommend if you ever go. It's very moving, of course, it's very intense, but it's something that I think everyone can gain from. Let's see what's next. So we have Ghana as the first African state to gain independence from the British. It really sparked what was called a decade of freedom. So there were colony after colony after colony after Ghana that gained independence from the British, from the French, from the Portuguese, but Ghana was the first in 1957. Let's see. And even today, Ghana maintains a really stable democracy. It's a very peaceful place. There's not a lot of violence. Petty crime, might be robbery, but there's really no guns around. There's, you don't fight in public. It's a really peaceful location. I feel very safe there all the time, even going on my own. It's a really nice place to be. So I really appreciate their outlook on peace. So let's talk about Ghana, the education situation in Ghana. If anyone has heard about the Millennium Development Goals, they were initiated by the UN in the year 2000. The deadline was 2015, and goal number 2 was to gain universal education. So that means that everyone in a country has access to primary education. And it also focused on gender parity, so making sure that the amount of students in the schooling wasn't just unequally distributed between male and female. They wanted to have equal distribution between male and female students. So Ghana actually attained Millennium Development Goal number 2 by reaching universal education at the primary level. And that is because they made primary schooling compulsory. So you'll be in trouble if your child is not going to school, and also free. for the government schools. There's a private schooling system, which we'll get into, but schooling is technically free for primary students, which are age, I guess what we'd call K through 9. So through 9th grade through age 14 or 15. So that's really great. The literacy rate is really high in Ghana. The language of instruction is typically English from the British colony leftover. And then there will be, classwork and conversations, of course, in the local dialect. And there are around 200 recognized local languages. So there's slight differences between a lot of them, but there's a lot of languages going on, and it will vary from town to town, which is pretty fascinating. Then we get into secondary school. So secondary school is considered beyond 9th grade. You can see the drop in completion rates between primary and secondary. That is because secondary is not compulsory, of course, and oftentimes students will go off to work at age 15. Maybe they have a financial need to work. Maybe they're just not an education focused student, whatever the case may be. It's very common to complete primary school and not to go on to secondary school. And actually, secondary school requires an exam as well. So you take an exam after your 9th grade year in order to place into secondary school. And there's different schools based upon what level you place into, which I think is an interesting approach. But if you, for example, only got a D on an exam, just to make it comparable, you would go to a D school. If you got an A, you'd go to an A school. So that's a little bit interesting. I think it might create more disparities down the line, but I don't have the research on that to show you that today, but that's how the system is set up. Senior high school was a paid elective option until 2017, when the current president, Nana Akufo-Addo, he made secondary school free for public schooling. So that was a huge move in 2017. It didn't really help our project financially because all of our students had already entered secondary school by that year, ironically. So good for the Ghanaians, not necessarily for our bank account, but that's okay. And I do say free in quotations because you are still paying for some things. You're paying for your exams, for example. You have to pay to take the exam, to sit for it. You sometimes have to pay for your supplies. You might have to pay for excess fees. Maybe you just need extra schooling. That's not free. If you are eating at school, that's also not free. So the word free is sometimes misleading. It makes it sound like everyone can just go and obtain the same education, but there are still cost barriers, especially for the very poor. Then we get into tertiary school or university. You can see the huge gap between secondary and tertiary school, 57% down to 16%. There's no obligation to go to college. There's actually currently a bit of a lack of incentive to go on to college because even if you have a degree, unemployment is so high in Ghana. I don't have the rate actually, but it's so high, even for people with degrees, it's incredibly hard to get a job. So people are finding, why go on and pay university fees when I can work a physical job and be paid right away. So there's a lot of cost benefit going on with university. There is the University of Ghana, though, in Accra, just outside the suburb of Accra. And I want to mention that it is ranked 15th on the African continent. It's a huge university. There are hundreds of thousands of students, actually, literally. It's a very massive campus. It's beautiful if you ever get the chance to walk through. But there is a lot of public and private schooling available in Ghana if you were to take that on. So then we get into quality of life in Ghana. First, the Millennium Development Goal number 1, which was halving or cutting in half the portion of people who are living in extreme poverty. Ghana actually succeeded in obtaining that goal in 2010. So as you can see, the amount of people in extreme poverty in 1992 was 56.5. So that's an incredible amount of people in extreme poverty. They reduced it down to 23.4 by 2016, but that was, now that we're at 23.4%, the decrease every year is getting smaller and smaller. So they're having a really hard time getting at the people who are maybe just at the cusp and can't get beyond it. Maybe it's an education barrier, maybe it's a health barrier, definitely an access barrier. But they still have a significant amount of people that are living under the poverty line, which is actually $1.25 per day. And that getting down past 20% is going to be a real challenge. But compared to the rest of sub-Saharan Africa, which is at 41% of the population living below the poverty line, Ghana is doing pretty well. So relatively speaking, the country is pretty prosperous. Actually, in 2017, Ghana was the fastest growing country in the world. They were growing at over 8%, which is quite unheard of. So that is a big thing to note. They are industrializing, they are developing, perhaps at too fast of a rate to care for making sure that, humanitarian efforts are increasing at the same level, especially something like health. So maintaining people's health while increasing economically is something that Ghana may need to focus on in the future. And that's what my thesis was on in grad school. So if you're interested, I have a nice document for you to read. And then I wanted to point out that, an increased level of education is found to have a positive correlation with health in Ghana and elsewhere. That might sound obvious to us. If you're more educated, you have more access to information. You might have more exposure to people who do care for their health. But there are actually not a lot of studies on the ground that focus on this correlation because we just assume, but I did find some that I wanted to bring to your attention today. So we have a study that I found really helpful. They had this chart. I did not make this, but they developed this based upon their study results, that formal education led to cognitive and decision-making abilities, which is of course what you learn how to think in school, or schooling teaches you how to think. And at the same time, you're gaining health knowledge just by being exposed to others who have health knowledge. Maybe you're taking a health course in school. Maybe you are being impacted by your teachers or your friends, families, everything like that. And then with the ability to think and the knowledge, you might engage more in protective health behaviors. So that was what this study found. I have my resources at the end if you're interested, but, and to quote the study, it was individuals with more education in Ghana specifically practiced more protective health barriers. So here's the scientific formula for their hypothesis. And I wanted to also note that they don't just make the decisions, but you gain an ability to appreciate the consequences. So understanding that if I don't, let's say, get my flu shot, I might get sick. Maybe I don't, engage in safe sex and I see the results of HIV/AIDS all around me. That could be something that would be a decision-making process for them. Actually, I'm going to stay on this slide. Let's see. And then more studies that I was looking into, another published by Health Policy established a very direct relationship with a mother's education and child survivorship in Ghana. I think that kind of speaks for itself as well, that as if a mother is more educated, she may make more, I guess, smarter decisions about her child's health as well as her own health during the birthing process. And that study specifically, of course, recommends an increased emphasis on girls' education in Ghana because they have seen such an increase in the health of the mother and child when the mother is educated. Yet another found education level to be a key determinant of using maternal health. So whether that's obtaining prenatal care, if that's using family planning, those have been indicators of improving both the mother and child. And then finally, a study in the Global Journal of Health found education, again, to be a determinant for membership in Ghana's national health insurance scheme, which actually aims to increase access to basic health care for Ghana's very poor. And this is because in places like Ghana and places in the developing world, you may go to the ER, ask for a service, and you will immediately ask to pay. So if you go to the ER here in the States, you will be seen, you'll be cared for, whether you can pay up front or not in typical circumstances. That doesn't happen there. So if you cannot pay at the time of entry, you may not be seen. The Ghana National Health Insurance Scheme, NHIS, is aiming to reduce that barrier to access to healthcare. They will still be slapped with a bill at the end, and there's questions about how much the insurance actually helps after the service is performed, but at least people are being seen and not being denied care. So that brings me to my reason for talking tonight. As I mentioned, I was a business student in undergrad, and I needed three credits of science in order to complete my general education. I was not about to sit in a classroom doing a biology course when I didn't really have any interest in it. I wanted to be in my Spanish classes, my global studies classes, I guess my accounting classes. So I looked under the faculty-led programs at Bentley, and one was going to Ghana, to the Greater Accra region and the Volta region in January term. So I had the opportunity to join that program for 3 credits and tour around Ghana for almost 2.5 weeks studying mosquitoes. So I was studying public health and transfer of disease through mosquitoes in Ghana. And at Bentley, all of the faculty-led study abroad programs to Ghana were sponsored by the Ghana Project. Now, this was founded by Professor Diane Kellogg, who became a mentor of mine. She founded the Ghana Project at Bentley with the intent on bringing business students to Ghana, not only to study things like public health, but also to study the development of an economy, to intern at large firms in Ghana, to get an experience in the West African culture of business. And a friend of hers founded a school, a primary school in a city called Somania. So that is about 3 hours outside of Accra, 3 hours northeast. The school was founded in order to take in about 15 vulnerable students in the community there who would be unable to afford primary schooling. This was at a time, actually still, where private school is not free. So government schools are compulsory and free. Private schooling still costs money. And the reason that people still choose between private and public is that public still hasn't quite caught up with private schooling, which was obviously better funded. There was less turnover in teachers. Anecdotally, it's a better experience in the private schooling system than the public schooling system in Ghana. I don't have the data on that, but there's less crowding, it might be a better experience there. So these students were offered an education at a private school in Somania, and there were other tuition paying students, hundreds of other tuition paying students that also joined the school in order to offset the costs for these students who are not able to pay. So the school was started around that. There was, let's see, after 9th grade though, these students would be left unable to pay. So you have students who are educated well, not even just educated well, and at the age of 14, they would be left with nothing to continue on. So Diane brought the idea to the Entrepreneurial Society at Bentley, where my other co-founders took the idea and started selling traditional Ghanaian bracelets that you can see here on the slide that were actually strung by the students at the Mofotrom Education Center, the school in Ghana, to sell them for a little bit of a profit. So we were just trying to make a little bit of money, maybe get some experience in entrepreneurship, building a business, everything like that. So every time a Bentley group of students went to Ghana, they were always required to visit the school first, just to make a continuous presence. You never want to just go and leave. That's not very good policy in development work. So every January term, May term, summer internship, even long-term semester internships, they would be visiting this school called the Mofotrom Education Center. They'd be hanging out with the kids, hanging out with the tuition paying and non-tuition paying, with the headmaster and his family, all of that stuff, and having a great time stringing bracelets. So when I went, I was very interested and I wanted to know what the heck these bracelets were, how I could get involved when I got back. And I did just that the week I got back. So I went to the meeting with my little suitcase of bracelets. I said, I want to stay involved. And I got heavily involved with the other founders of what was then the Mofotrom Bead project. So we named the project after the school that we were supporting. So it was a student-run group of volunteers. We sold bracelets sort of exclusively on campus to my family and friends. I always joke that my mom has bracelets up to her elbow because that's who I was pitching to, which is great. We would do local events in Boston, so smaller tabling. There would be some farmers markets, some local craft fairs that we would attend, and there was fundraisers that we would develop at a local basis at school. We would throw, a party and have all the door prize or the door entry costs go to Project Bead. And then we would have our online platform, which we were developing. So we had inventory managed online. We would ship out, and I have photos, probably should have tried to find them, of my entire dorm room covered in, the manila envelopes full of bracelets that were shipped out, and we were writing all the labels, hundreds of them. So those are some fun memories from the beginning. But really, we were applying, the basic business skills that we were learning at school towards something that we found was, fun. And we'll get into that word later on, but that was how we really started. I was intrigued by the bracelets themselves, the need for this money to fund the education of these students who deserved it. They were working hard. There was no reason we could see in our mind to say that, no, we're not going to do something about this. So that was how we all began as the Mofodrome Bead Project. And then we were a campus club, and we quickly evolved into a social enterprise. So in 2011, when I joined, we had a president and vice president, my two other co-founders of Project Bead, who they made the decisions, they managed the money, they led the group on our weekly meetings. We had an inventory manager, that was me. So I literally had the hundreds and at times thousands of bracelets in an extra closet in my suite. And I was so grateful to my suite mates who let me have that closet. We just had shelves and boxes and beads everywhere. And then we had social media and marketing team who worked on our brand design. Again, this was business school, so we had someone from every group, and people were interested in just applying their skills, which was very useful in the long run. We had an accountant do our QuickBooks. So we had QuickBooks from day one, really. We would have volunteers who just wanted to be part of the group and wanted to table. They wanted to pitch to retailers, local retailers and retailers across the country, to help plan those fundraising events that I talked about. They would write grants, everything like that. So we had a nice little group going. But what I want to emphasize is we had roles and responsibilities and really a structure in place from the get-go. And I think looking back and speaking with other nonprofit managers, that really made all the difference. So starting with that is my best takeaway from all of this. And very early on, Diane recognized the importance of an interpersonal physical connection with the project, to make it not just about, playing around at business school. You had to have that personal connection to Ghana. And I think she immediately valued or saw the value in the cultural connection, the intercultural exchange, making sure that we weren't just doing this for fun, which ironically is probably what draws most people in, but really because we see that these are people, that they deserve this, that, what we have because of where we were born doesn't mean someone else can't have the same thing. And to make sure that we knew that we weren't just doing this as a hobby, that people's, honestly, livelihoods depended upon it at some point. So I was really grateful for that perspective and for her kind of forcing us in that direction at an early stage. And I think that really made all the difference in where we ended up. So we, in order to make that personal connection, we went to Ghana every year. We started in 2012, I went in 2011 first for school. The 2012 was our first, what we'd call our buying trip. So we visited TK, who's Florence here, TK Beads. She is a woman-run bead shop owner. So she runs the whole business herself. Her husband is there, but he has no part in it, which I think is fantastic for Ghana. She runs the show. So we would buy beads from her. We'd buy beads from local vendors at markets. We'd go into all the markets and pick out the colors and the styles and everything like that. And then we would, meet with the students. We would go to the Mofodrome Education Center and hang out with the kids who were there, get to know them, saw them as people, not just as a charity. We, were able to ask what their goals were in life. What do they want to study when they go to senior high school? What do they want to study when they go to university? And making sure that they knew who we were as people and not just as check writers. And that was instilled in us very early on. Let's see. So all of this time as a campus club, we were operating under the umbrella of the Mofodrome Foundation. So that is the foundation that Diane, my professor, and her her friends had founded in order to start this school, and they took us on as a project within the Moffatrom Foundation. By 2013, I think they kind of realized that we were in this to do this. We were not just a campus club. We actually wanted to take it off of campus. We were too restricted. So by 2013, the board recognized us as committed and able to really achieve our goals of funding these students' education. Funding their secondary education was the initial goal. So in 2013, they handed off their foundation entirely to 5 recent grads. I had just graduated in May. We took on the foundation in August. We had 4 graduated girls and 2 still undergraduate girls at the time that became suddenly board members of a nonprofit organization. We incorporated as a 501c3 immediately in New York. We realigned as an entirely driven social enterprise, and we got to work. So 2013, 2014, 2015, those are really the biggest years of Project Bead. We left behind Moffatrom Foundation, we left behind the Moffatrom Bead Project. As much as we love the connection, it was hard for people to remember, and that's an unfortunate thing, an unfortunate decision we had to make as business owners, that we had to make sure our brand was memorable, and make sure that people knew who we were. So we did have to leave behind the name. We switched to Project Bead, but we still made sure everything referred to Moffatrom Education Center and our past as a Moffatrom Bead project. So like I said, 2013, 2014, that's when we really started making money. We were way more than a club at this point. We had strategic programs in place. So I initiated bead parties. These were literally parties that I would drive my car around to with a bucket of beads, a little measuring cup, enough string for every guest to make 4 bracelets. We would charge an entry fee way lower than the cost of buying 4 bracelets, and we would allow young girls, anyone, to make bracelets that they wanted to design. They loved, touching the beads, picking out the colors, really getting involved with the product. So that was really fun. We made some money off of that. And then it got to the point where I couldn't go to all the parties, of course. So I'd have to ship a bead kit. We'd have a bead party kit all around the country. So that was really cool. I initiated some partnerships with some national organizations. We had specific bracelets that were tied to these organizations where we contributed a portion of our sales back to their organization every month. Our biggest partnership was the National Stroke Association, where we had a specific red and white bracelet that we sold in vast quantities because of people who were either impacted or just really moved by the cause, the National Stroke Association. So that was a great partnership. We also had, a Breast Cancer Foundation bracelet. We had a few different organizations that approached us separately just to say, hey, we really like the idea. Can we design a bracelet ourselves and we'll sell it to our clients and our customers? So that was great. Really, partnered in that. I developed the campus rep program. So we had 15 representatives for Project Bead around the country at one point at different universities running their own kind of smaller Project Bead clubs. So we had social media for them. We had a campus rep package. They got a koozie, they got a t-shirt, they got everything with Project Bead logo on it. And they just had a sales goal each month. I would check in quarterly. How many bracelets did they want to sell? How were they doing? Were they doing events? What were they doing to expand knowledge of Project Bead there? So that was a really cool expansion as well. And we still have connections with a lot of the leaders of those groups around the country, which is kind of funny. I visited Montana, for example, and I visited one of the Project Bead campus reps. Really got to know her as a rep, and we actually hung out afterwards, which was really fun. We even went into micro financing a little bit. That's something we actually learned from the hard way. I think I will get into some of the obstacles that came up as just a lack of knowledge and a lack of exposure, lack of us being really good intercultural communicators, things like that. So we did a microloan with a women's cooperative that we visited as well for a chicken feed mill in order to process the chicken feed so they didn't have to go into town on the crowded buses, bring the feed back on the top of the bus where people are dragging oil or there's actually animals up there. There's the risk of loss, everything like that. So that's something we dabbled in as well. We started really expanding our retailer outreach. So at one point we had our beads in over 20 retailers across the US, mostly New England. And a lot of that was started just by walking into a store and saying, what do you think about this bracelet? Would you want to carry it? We wholesale. We had line sheets. We had, online ordering specific for retailers. One of our founders was a buyer at TJX, so she had all of the retail inventory process down. So that was really great. Probably the most profitable thing for us were events. We would do events at least once a quarter, large tabling events, large conferences. We attended the Massachusetts Conference for Women every year, where we would make thousands of dollars just in a few hours on bracelets. We would sell also thousands of bracelets and get our inventory out for the next year. And then in the month of December, we were somewhere like twice a week, even 2 to 3 times in the same weekend. We'd be passing off the inventory between cars. We'd be running around all over New England, Boston, Rhode Island, up here in Portland. We were doing a lot, so it got quite busy. We implemented a customer resource management system, CRM, Salesforce. So we implemented that for our group. Customer relationship management, that's what it is, CRM. We implemented that so we could track our outreach. We could remember who were our partners when we contacted them last. We'd get insights on who was, a hot lead, everything like that. So we were really cruising on the connections. We did a lot of product development. So we expanded from just bracelets. Well, we updated the bracelets first. We realized that American buying was a lot different than the Ghanaian selling, the interests. So we started to take pieces of different beads and putting them together in different ways. We would really try to align them with local trends here in the States. So we got away from we got into some of the, trendier colors. We had neon, we had tassels, we had different patterns, we had different sort of collections for different types of people. So we really got into the product development side as well. We expanded into fabrics. So we made bags out of fabric made out of mud cloth from the north of Ghana, where we attached a bead to the little tassel. We made t-shirts with our logo on them, our little slogan, which was "Be a Giver." We had that all over everything. So we expanded the products as well, which also helped with revenue, different sort of revenue streams. And then, like I was mentioning, we really had a strong business going on, or business side going on in the background. So we had an accountant who was doing all of our work. Of course, she went to Bentley and it was an auditor as well. So she was doing all of our books. We had annual reports. We had quarterly reports. They're obviously not required for a small nonprofit, but we had them. We had a profit and loss statement. We had a balance sheet. Everything was updated quarterly. We give those out. We reviewed them every year. We had budgets ranging between $15,000 and $20,000. We had our Google Drive, which is, to be honest, immaculate. It has every area of the business. Every folder is perfectly organized. We had best practices for everything that we did. So when I would enroll a new campus rep, I had a best practice sheet to follow. When I would reach out to a retailer, I would refer to that best practice sheet. So we developed a whole entire system of how to run this business, and it paid off, literally. Our highest year was in 2015, and we took in over $47,000 in profits of just selling $10 bracelets. So that was really great. Let's see. Actually, before I get that, I wanted to point out though, what really tied us, like I mentioned before, was that we kept going back to Ghana. So we made sure that we knew who our vendors were. I was texting Florence, the bead maker, bead owner, all the time. I was talking with our guy at the market in Accra about the fabrics, all the time. We were on calls. We were communicating with the students. We started video chatting them. We started having conference calls with the headmaster and the family there. So we really made the human connection, which I think does make all the difference. When we were able to expand into the bag making business, we were able to pay different groups of women to sew the bags, to create different kind of bracelets. We expanded our reach of people that we were impacting by just expanding our products. We were, able to ask for more people to do the work, which was wonderful. We were able to ensure that we were impacting others' lives as well, beyond just our students. We were paying local women, local men to make our products and make sure that everything was Ghana centric. We never took anything ourselves. Of course, we were all volunteer run. We still are all volunteer run. And it feels really good to know that our products are coming from Ghana. We're paying the producers and the makers, the artisans in Ghana, and then the money is going back to educate more Ghanaians to hopefully keep them in Ghana as well. That's a point I want to make, that we aren't necessarily encouraging them to, apply to study in the States. We want to make sure that they are able to contribute to their local community, to their local economy. And I think that has value as well. We also maintain the theme, like I mentioned, that this was not a charity. This is something that we were passionate about because they deserved the same access to education that we had, and that we were really making sure that they were able to improve their quality of life, just because they were able to gain more education, they're able to obtain degrees, they're able to then get better jobs, and then have family planning. Maybe they know that they don't want to have children, and that's okay. Maybe they want to focus on their career. Give just a wide range of knowledge to these people who might not otherwise have it. But there was always obstacles along the way, of course. There was a lot of cultural difference that I've mentioned. And that was a learning process, because I didn't really start to study intercultural communication, intercultural understanding, until my graduate studies. It was something that I was interested in, and I realized that I wanted to know more about at a pretty early stage, but I hadn't done the work on my end to really understand why we were running into these roadblocks. Maybe for example, we were asking the wrong questions. Ghana is typically a culture where you don't provide an answer unless you're specifically asked. And you have to make sure that you're asking the right question in order to get the right answer. I might say, "How are you doing?" They'll say, "Fine," of course, as we say. I might ask, "What do you need for school?" They will say, "Tuition fees." It's like, okay, how much are tuition fees? This. Okay, how much is rent? This amount. Maybe that's the total amount that's split between 4 people. I didn't ask how many people are splitting that rent. So it's an ongoing conversation, and it's just making sure that we're aware of how to target what we actually want. As Americans, we overshare typically. Our culture is very outward. We are an outward facing culture, as opposed to more of an intrinsic culture that the Ghanaian people have. So if you don't ask, you definitely won't get an answer. And even when you do ask, it has to be the right question. Like I said, we learned that the hard way a lot. We ran into a lot of roadblocks with the headmaster of the school, who honestly was just looking out for the best interest of these students who had become his family. You might wonder, if you went to our website or you knew us from an early age in the business, why we don't really have pictures of our recipients. That was always a huge butting head issue. We wanted to show our customers who these students were, what they look like, what they want to do, where they come from. Well, you know what? They were teenagers and they didn't want to show who they were. Maybe they were self-conscious. Maybe they were worried that their new friends at senior high school would figure out that they're on scholarship. Maybe they didn't want to be treated differently by the teachers, who might look down on them because someone else is paying their bills. There was a lot of undertones that we had to kind of get used to, and really, like I said, ask the right questions and get to know why the answers were where they were. Sometimes teenagers are just not good students, and you wonder why they're just underperforming or don't want to go to school. Well, you know what? He just doesn't like school. And there's a lot of my friends who maybe I didn't even like school at one point, so teenagers are teenagers around the world, and kind of remembering that was important as well. For example, we had to learn the hard way with the students that when we are giving money, which I'll get into, we had to be very explicit, and also remember that, like I said, they're teenagers and sometimes they're going to spend it on the wrong thing. And you're thinking like, how could you buy that item of clothing that was supposed to be for your food? But you know what? They didn't want to eat a meal out that week. They wanted to save it for their clothes, and that's okay. Things like that. So as I developed more as an intercultural communicator, and as more of a, with a more, formal global studies background, a lot of these things came to light. It's like, okay, of course, we didn't ask the right question in that point. When I mentioned the microloan, the feed mill actually didn't get built that we bought because they didn't have a structure to cover the feed mill. We didn't ask how they would winterize, or not winter, but weatherize the feed mill during the rainy season. We just bought a feed mill and said, go have fun. Well, they didn't have the money to build a structure around it to keep it from the rain. And that was something that we just didn't ask, and they didn't tell, because in that culture, it's not appropriate. We had given them a lovely gift, and that was wonderful. So why would they ask for more? When we're sitting here saying, why wouldn't you ask? Like these, we would have done more, we would have fundraised more, we would have allocated the funds differently, we would have researched more options. So things like that came up, and it was important to gain the skills that we needed to communicate effectively and make sure that we are all on the same page, which came to be, after a while. But and then the numbers. So as I mentioned, we were funding the secondary education of 15 students originally. We quickly realized that we had way too much money, which is a really good problem to have. We would review quarterly, our growth and our progress, and every quarter we were surprised, and we were just happy to be where we were. So after about 6 years, so from 2011 to 2017, we raised over $200,000 in sales and donations, targeted donations. So whether they were requesting to donate for books or requesting to donate for meals at school. So that number was reached. Cumulatively, it was 85 years of education to be funded. So we had 15 students. We were able to pay for their senior high school, which was 3 years, and then we were able to finance university. So that was the big decision. We realized that as we were really connected with these students, with this community, we wanted to see them through. When we realized the money we had made and the impact we could have, it was a decision point of whether we would expand into more students at a younger age, or whether we would see these students through all the education that they could have. And that's a decision that I think we could debate, all night, which was right. And I think I still do go back and forth a bit. I think for the place that we were in as young adults, as women in the workplace at a very early age, we were also finding ourselves a bit overrun. We weren't able to sustain, working ridiculous hours in auditing and wealth management and everything that we were doing, and still contribute all of our hours that we were doing on the back end on the weekends before and after work to running the sales side of the business. So when we realized that we could actually, make a huge impact on these students and sort of trickle out the sales, that seemed like the right decision at the time. Had we been able to fund, our livelihoods at the same time as this, perhaps we would have made a different decision. If it were earlier in our lives and we were just getting started in the workplace, perhaps it would have been a different decision. So what we decided to do at the time was see all of these students through secondary and on to higher education. So along the way, that resulted in, like I said, 85 years of education, 3 years of senior high school, and then we are able to fund all university years for all of these 15 students as well, which could range between 3 and 4. So depending on what sort of degree, what sort of program you were going into. Within our little group, we have a 93% secondary completion rate, which, if you can remember, the average rate for Ghana is 56%. So in our very small test group of 15 students, we're doing quite well against the national average. And I will say that we did have one student who just didn't complete secondary school. That was a decision we had to live with as well. she did not pass the final exams, and then you have an option to retake the final exams, of course, pay for them, which we were willing to do, but it just wasn't something that she and her family decided on. So she's back with her family, and she does not have her secondary degree, but she is with those who love her. So that was a decision we had to, come to terms with as well along the way. 75% of our students are on track for a higher education degree. So one of our students is, for example, becoming a radio host. So it's not necessarily a degree, but he is going to schooling and training school for radio and media. One of our girls is going to beauty school. So it's not necessarily a degree, but still training, something that can give you a skill in order to obtain work. And that's really our goal. You don't need to show us what degree you have, but if you have the ability to work and provide and better your situation and your family's situation, that's the mission of Project Bead. So with all of that, we still have money left over, and we're still selling here and there, and we're still receiving donations here and there. So we are growing our leftover fund, and I'll talk about our hopeful recipients of the scholarship towards the end of the presentation, but money to spare, which is always good. And, when it comes down to it, we are impacting 14 vulnerable lives positively. So they are, they attended senior high school, they attended university, or obtaining a skill, a degree, some form of further education in order to better their situation, where they were unable to pay even for secondary school. They're now able to hopefully work, earn money for themselves, for their family. And we like to believe that we've had a positive impact from what I hear from the students and the messages we get all the time. And we share photos and family pictures, and I send them pictures of the fall, and we talk about their favorite seasons. I think that has been fulfilled. And if you couldn't tell, the point of this presentation is that they are more than numbers. They're human beings, they're people, they're students, they are young adults. They're awesome. They're great. So these are a couple pictures of our students. One on the right, she's in nursing school. So we're very proud of her. She's working very hard. And I love her little cap. It's very cute. And then we have on the left, one of our students. The other is just a, what do you call it? Yeah, thinking of not a colleague, but a co-student. Yeah, classmate. Yes, exactly. So on the right in the pink shirt is one of our beneficiaries, and he is in engineering school. So he is studying to become an electrical engineer. Actually, past tense, he graduated in August. Schooling was delayed. The term was delayed because of COVID. So he just graduated as an electrical engineer, along with another one of our students. So we have electrical engineers, we have nurses, we have a hairdresser, a woman studying business, radio show host, IT specialist, a computer programmer, really technical skills that will carry them into the workplace. So we're very proud of who they are beyond just our stats. Okay, so this brings me to another theme here is to stay connected to the people. You will find making connections in this global development space is the best way to not only expand your own range, but get to know more people and learn what they're doing and see what they are doing in their workplace and how you can do your work better. Through Diane, my mentor, I met a young woman my age named Lauren, who visited Ghana in a similar fashion in high school. She was living in a homestay in a community where there was no primary school. They would have to walk for hours, literally hours, across, I kid you not, a mountain. This is not exaggerating, in order to get to the closest primary school. And there were 100 or so, maybe 200 students in this community. And her biggest question was, how can there not be a school here? So she founded her own organization in order to build the school. And that is actually who we hope to give our leftover money to for scholarship funding. So her school was doing very well. She actually lived in Ghana for 2 years. So I visited her a couple times. And I reached out to her when my partner, Chris, was interested in coming to Ghana with me. But he wanted to do his own thing, which is fine. I had my Project Bead thing, my education thing. He is a physician assistant, so he wanted to see how he could contribute in the medical field. She put me in contact with someone else, who put me in contact with someone else, who said, hey, I have this foundation who I've worked with called the Divine Mother and Child Foundation, DMAC for short. And they are working to reduce maternal and infant mortality in Ghana, in the very rural Ghana, by bringing along ultrasound machines on their way. So they bring a little ultrasound machine in a box, like if you can see, I don't even know if you can see me right now, but I think like this. Yeah, a tiny little thing on the back of a motorcycle. And they give the one and only ultrasound that many women will ever have, if that. So they're going around to rural communities in Ghana, more in the Volta Lake region, although they are going north more and more and as they're expanding. But these are community health workers, so they are government employees technically, but they're doing their own nonprofit work on the side. So we were able to join DMAC on a 3-day visit to a island community in Lake Volta, which is a man-made lake. It is very fascinating because it was built, or it was flooded within the last 50 years. And the water is, it looks like an ocean, but there are trees coming out of it. So it's very confusing. But it's a beautiful place. It's very hot, very dry. We were going to a community that is completely isolated. There's a ferry that gets there, but it goes down half the time. We went in a wooden boat, as you can see on the far right. And we did primary and maternal health clinic for 2 days. We saw over 300 patients in 2 short days. Actually, that's a lie, 365 patients. As you can see in the top left corner, people came and waited. We set up a little bit of a shade zone so that it wasn't too hot. Chris was doing, primary screening, as well as the community health workers doing maternal health screening, running the ultrasound. We were weighing newborns. We were administering vaccines. We were, diagnosing malaria, for example, which is extremely prevalent, especially in this sort of community living on the water. We were, just hearing about aches and pains. I think one of the most impactful thing that I heard there was just the complaint that people's hips hurt. I mean, they're old and they have been working for a long time and their hips just hurt. And it was so moving to see us run out of Advil, for example. We just ran out. We just didn't have enough. And we brought suitcases. And it's like we could only give one woman 5 ibuprofen. And think about how quickly we pop an ibuprofen if you have a little ache and pain. I mean, we gave her 5 and she's working laboriously in order to sell anything at the market, and we only had 5 ibuprofen for her because there were 300 other women who also needed ibuprofen. So that was kind of a really good experience for me to get out of my little bubble in Ghana and see even more of a need beyond education, but what education can do to help with this level of poverty. So there was a lot of high blood pressure, a lot of aches and pains, like I mentioned, diabetes, a lot of micronutrient deficiencies. So there were, you wouldn't think that there was starvation here. I mean, people are fed, they're just eating the wrong thing. So maybe there's a super high starch component to their diet, because mostly what they eat here for, big filling meals is fufu, which is the yucca plant pounded down into a powder, and then because they're like malleable. So that doesn't have a lot of vitamins. It is white starch, and that's a huge portion of the diet. There's a lot of fish, which can help, but it's also coming from this lake, which is man-made, and there are not good environmental policies in the lake. The drinking water also comes from the lake. So there's a lot of waterborne disease. I was not treating, Chris was prescribing, I was transcribing a lot of need for just intestinal bugs. There was a lot going on there. We also witnessed, the kids running out with their buckets to get the water, bring it back right next to our boat with the motor running, literally right next to it. So that was a bit shocking as well. But that is island life in very rural part of Ghana, and a lot of places around the world as well. So we had a very good trip. It was a lot of work, but it was really great to, see that we could connect with other people doing incredible work in Ghana just because of, going there multiple times. This was my 6th visit to the country in 6 years, which was really nice. And I got to actually, see old friends. I would stop in the market and say hello. And it's a really nice tie-in after a lot of long, hard years of contributing back to the culture, seeing that I can actually, communicate and really just be there, not as an outsider, but as someone who really, does work and sort of fits in at times, which is nice. Let's see. Let's move on to my takeaways. So that is a long-winded story of my social enterprise. And as you can see, I was trying to loop in most of my themes around global development work, global health volunteering, the impact of becoming connected as a person rather than just writing a check. The impact of listening to learning from other cultures, from really hearing what is needed, and not making it about us. I think that's the biggest piece that I have learned to take away over the years, is that when someone asks me why I do Project Bead 10 years ago, that's crazy to say, but almost 10 years ago, it might have been because I have been given so much. I have such a good life here. I want others to benefit as well. Well, that inherently is the wrong way to look at it. I have nothing to do with this. This is not about me. This is about others who deserve the same. It's when we shift that focus from ourselves and start to think, okay, I'm doing this because they're human beings just like me, and we should all have, I believe, a similar access to health, to education, to basic human rights. And I think that really shapes the success of an organization. We were able to stick it out with these students and not just expand to tally up the numbers. I think that was something that we really came down to. We just didn't want to provide education for thousands of students so that we could say we educated thousands of students. We wanted to really make sure that these ones that we were working with felt a connection, didn't see us as just, a charity giving money, and as human beings as well. So to really connect and develop as intercultural connections as possible. So I wanted to recommend some of my favorite moments of learning as well. Poverty Inc. is a incredible documentary. It's on YouTube. I don't know where else, but highly recommend it. It's just about an hour long. And it really speaks to the piece that I didn't know how to put it into words, but when I heard it, it was perfect. That you have to be, if you are in the global development space, you have to be willing to walk away and to say that I am not needed anymore. You have to be able to say that, like I said, you don't just educate to tally up your numbers. You have to say that, okay, we've provided this education and now we're completely irrelevant. We can step away. So the business of social enterprises is a really complex one. And I think this really speaks to how a lot of, nonprofits or social enterprises are just there to kind of do the work because of the fun of the business, which is inherently wrong and won't really make it a sustainable practice. If you have to have people in poverty in order to stay in business, there's something wrong there. There's a really great book called Hoping to Help, which discusses more along the side of global health volunteering, which I think is specifically applicable to my work at Partners. And this was a really big impact on me, both in school. I had a lot of focus in my classes about this book, but also just in running a social enterprise and then hoping to build a career out of these experiences. So again, speaking to the problems with global health volunteering when we can just kind of dump resources without thinking, without really knowing what's needed, just to say that we did it. So I also recommend that book. Maybe not the whole thing, but there's a lot of good chapters. And then Dead Aid is also a really good book. It is about the business of aid, again, and what can go wrong when sort of the same thing. People just dump grains on, let's say, East Africa when they're in a drought. Well, there was leftover from last year that's now not being used in the storerooms, and that's going to waste. And now the East African farmers are not getting their crops out, and they're just overloaded with, either US or European or whatever, just dumping their crops on a location. So there's a lot of impact there. And this author argues that the help doesn't really help. So it's strong. It's really interesting to think about, but I highly recommend just the contrasting opinions, which I found very helpful in my own education. And that's it. Thank you. Okay, yeah, we have plenty of questions. I can see the screen blinking. Okay, this is gonna be fun. How did you find the people who make the single beads? That was luckily not hard at all. The beads are very common in Ghana. They're actually very cultural and traditional. So you'll wear certain beads at certain times in your life. Bead making is a practice that's been going on for thousands of years. I kind of skipped over that part, probably should have talked about that, but it's pounded down glass. So it's recycled glass that is hammered down in a huge vat, metal something with a very heavy, kind of like a mortar and pestle, but just really, really heavy. So they pound down the glass, they pour it into a mold. They might add coloring to that. Usually it's natural dyes, so they might take it from a natural source. I mean, they've branched out, of course, into synthetic dyes at this point, but you can stay natural if you'd like, which we tried to do. And you pound it down and you fill a mold, and then you kiln fire it once, very, very high heat. You take it out. You might paint it. So these intricate designs here in the middle, those are hand painted with almost like a toothpick. And that's done by hand, typically by men. And then it's kiln fired again. And then it's taken out and it's glossed and it's kiln fired again. And then they're strung. So it was not hard to find these amazing beads because they're everywhere. If you ever visited Ghana or West Africa in general, you'll find these beads made from glass. But if they differ, of course, between cultures and now states. So for example, a Senegalese bead looks very different than a West African, than a Ghanaian bead, but it's a similar process. They just have a different style. So specifically the ones who made our beads, just more connections. Like I said, we kind of just asked around. We knew people who were in the bead making business through people that we bought from in the markets, and they would say, oh, you can just go straight to the vendor. Her name is Florence. She works an hour up the street. So we would drive there. She had a lovely business. And then we would just hear about more and more connections. So asking to meet people is a great takeaway as well. Okay, and I think I answered the next questions. Who made the beads? Oftentimes they are made by men in the community and then painted by the men as well. And the women do the stringing typically. So it is not an entirely female run operation. I would be remiss to say that, but the men do the kiln firing and oftentimes the painting, and then the women would be the ones who string it. We do buy our beads from a woman who runs her own bead making business. Her name is Florence, TK Beads, if you're ever in the area. Where can you buy the beads? So for me, you can buy them on projectbead.com. They are in a lot of boutiques these days. So you can see if you see beads like this, they're more of the glass ones, kind of like the see-through, sea foamy looking beads. So they can sell for a very high price, or you can buy them about $12 a bracelet from me online at projectbead.com.
So Laura.
Yes.
I have a question. If you were buying the beads from some of the women that you found, do they also have other people like you that they can continue their business, or were they just relying on you for the purchase of their beads?
No. So, well, one of our ventures was with women in a very impoverished community in Accra, right on the dump. So there is a dump community that lives and kind of thrives off of that. So they'll be looking for recyclables, for things that they can sell. So it's right on the edge. Ironically, it's right on the beach as well. Very beautiful beach. So we were working with those women who were selling, typically sellers of wares. So they might have, a table that they will bring around. Maybe they're selling food in the street some days. We were paying them per piece. So that was something that they were only getting from us. And we were able to make connections with them over the years, and go back to the same women every time. Florence, who I've mentioned a couple times and showed the photo of, she is doing very well. I know that she sells to large boutiques in the US. I don't know how her name got around, but we were not keeping her business alive. We were giving her a good name in the same way that her other customers do. I don't know. We would actually customize beads with her. So we would ask for certain patterns, we'd ask for certain painting, certain styles, and we were the only ones to be that picky apparently. So everyone else just buys right from her. But that was a fun little venture for her to expand in the matter of customization. And we had a hard time with what's the word? Quality control sometimes, because wrists, the size of wrists here in the States might be smaller, or the style of wearing bracelets tighter, I should say, was different here. So we had to have a mold made. We did like a 3D printer, a friend of a friend made a 3D printer of the right sizes. So we'd have a small, medium, large, and we shipped that over, explained, quality control here in the States, how every bracelet should fit correctly around this mold. So even though we weren't keeping her afloat, I do think that we imparted some different outlooks on selling to more particular customers, as opposed to those who might just visit and pick anything up and be happy, which is great. But I think she did develop a little bit of the business side for herself as well to keep in mind for future. So we're not keeping her afloat, but we were some of her more regular customers and definitely larger buyers consistently. Okay. How did I lean on my mentors throughout your experience with social enterprise and other endeavors? So Diane, who I've mentioned 1,000 times, is probably my biggest mentor through understanding how to exist in this world. I would say she is a wonderful woman who just has so much knowledge, and I lean on her for a lot of things, even without knowing it. So she may, make a recommendation. She never tells me what to do, but then will kind of guide me along the way, ask the right questions, as I've learned. So how have I leaned on her? I mean, career-wise, always letting her know what I'm doing. She could always tell when I wasn't happy in a career. So that's someone I just keep going back to. Yeah, that's how I leaned on her. I keep in touch all the time, we keep life updates. We call every now and then. And most importantly, we stay in touch about Project Bead, because she started this all. Really, it was her idea and she brought it to the right people to carry it out. But this was her baby, and I know that it was a little bit hard to hand off, but I think she's very proud of what we've done. Let's see. What point did I feel I had the knowledge and confidence to initiate projects on my own? I was kind of forward in that I just did it. I think it's very important to have confidence in yourself. I did a lot of research though. I would see other companies, what they were doing. I would take it all in. I was trying to be as much of a sponge as possible in the social enterprise space and really see what we could do. And I knew that Project Bead had the potential. It was just a matter of doing the work. So I would go in to my co-founder, but she's the president, and I would say, I have this plan, and here is ABCD how I'm going to attain it. I have a budget. I have a presentation on showing you the outcomes. I have an expected revenue projection. I have everything in place so that I can prove that I can do it. And I think going in with all of that is really important, not only in Project Bead, but in life. Just doing your research, knowing what you're going to do if something goes wrong. You obviously can't predict everything that's going to happen, but having the ability to shift and be flexible and just be confident, but confident because you did the work first.
Good job.
That's it.
Are there any other questions?
Yeah, you can undo your thing if you want. That's
Feel free to just ask them individually if you'd like, or make any comments.
Let's see. Okay, cool.
Laura?
Yes, hi, Mary.
Hi. I just want to say that the work that I've done in my life, that it took me many, many years to appreciate what you were talking about the innuendos and about the communication when you're working with different cultures, and how long it takes to get familiar, and to even understand that you have to be more familiar.
That's the biggest piece, to even know that you have to.
Yes.
Yes.
Yeah. I can so appreciate that, and about asking the right questions, and knowing that sometimes the answers that you get are not really what you're looking for, or
Yeah.
that's not what you
Not what
sort
you
of
meant
were
by your
going for.
question.
Yes.
Yeah. And that is a whole other education piece. So I like the resource that you have listed there about, I forget what it was. It was one of the 3
Yeah.
resources that you listed. But that is so important with the work that you do, and it's so underappreciated, I think, too.
Yeah. Nowadays, I should say, it's becoming more of a academic area of study. So, for example, I took a course on intercultural communication and leadership. The company I used to work for had, on every study abroad experience, you would take a intercultural assessment of where you stand in that realm. You would take a course for 3 credits on intercultural communication and leadership, like I mentioned, and then another assessment afterwards to see how you've improved. So I had the opportunity in my grad school to take multiple courses on the topic, which I think is so important, and it should be a core requirement for anyone. I mean, it doesn't have to be global studies. It should be public health. It should be anything. It doesn't matter.
It's true.
And
It's very true.
And it's not necessarily only applicable to different cultures. I use those skills in my daily life because everyone is a little different.
Is that right? That's right. That's right.
It doesn't have to be someone from a different world. It can be someone from a different background, from
Yes.
different position,
Right.
current status in life. So I totally agree.
Mm.
Yeah.
Well, that's great, Laura. What about anyone else have any comments? Well, I like the whole idea of a social enterprise because it has such benefit for somebody else.
Yes.
Definitely have, whether it's the improvement in healthcare or it's the improvement in their educational status or in their environment, their families are better off. So I think that's great. Really, really great. Thank you very much.